What happens in type 2 diabetes? Hello, I'm Dr. Jimmy Douglas, and in this topic of type 2 diabetes, which is predominantly seen in adults, and nowadays it is seen in children and adolescents also. Cause of diabetes type 2. Underlying cause in type 2 diabetes is not absolute lack of insulin as in type 1 diabetes. It is due to lack of action of insulin, and it is due to insulin resistance. Genetic and environmental causes both combine to cause both insulin resistance and beta cell loss. Obesity is seen in 30% of patients in type 2 in Chinese and Japanese. 60 to 70% of patients are North American, European or African. So there are many patients in type 2 diabetes who are not obese, but they have visceral fat. They are called as metabolically obese. Visceral fat is accumulation of fat on the organs. Or truncal obesity is far more dangerous. So it's important to watch your waistline. Type 2 diabetes symptoms. While increased urination and thirst may be presenting complaints, most of the patients remain asymptomatic, that is without any symptoms. The symptoms in type 2 are less marked and the diagnosis is several years after onset. That's why it's important to know the risk factors. Who is at risk for diabetes type 2? Genetic and environmental factors are major risk factors. People who are obese are at risk. Visceral obesity, as mentioned before, is linked to insulin resistance. That calls to watch out for the increasing waistline. The risk increases with increase in age. Leading a sedentary lifestyle ups the risk, while high blood pressure and abnormal lipid profile are the risk factors to watch out for. Since many people are at risk, we cannot screen the whole population. So those who are at risk, for their own good, they should get checked, as most people don't show any symptoms until it's very late. Diagnosis of type 2 diabetes. Many patients who are obese over the age of 40 have few or no symptoms. Polyuria, polydipsia, ketonuria, and weight loss are uncommon at the time of diagnosis. Plasma glucose of 126 mg per deciliter or more after an overnight fast on more than one occasion. 2 hours after 75 gram oral glucose, plasma level of 200 mg per deciliter or more, HbA1c of 6.5% or more, hypertension, dyslipidemia, atherosclerosis are often associated. Counselling after diagnosis. Many patients are not able to come to terms that they are diabetic. They are either scared or in denial. While it's important for you to keep the blood glucose level within normal limits to avoid complications to the eyes, heart and the kidneys. A type 2 diabetes treatment. A well-balanced, nutritious diet remains the fundamental element of therapy. In general, most patients with diabetes consume about 45% of the total daily calories in the form of carbohydrate, 25 to 35% in the form of fat, and 10 to 35% in the form of proteins. There is no specific recommendation on the percentage of calories that should come from carbohydrate, protein and fat. In patients with type 2 diabetes, limiting the carbohydrate intake and substituting some of the calories with monounsaturated fats such as olive oil, canola oil, or the oil in nuts and avocados can lower triglycerides and increase HDL cholesterol. A Mediterranean style eating pattern, a diet supplemented with walnuts, almonds, hazelnuts and olive oil, has been shown to improve glycemic control and lower combined endpoints for cardiovascular events and stroke. Dietary fiber. It's important to take foods such as oatmeal, cereals and beans with relatively high soluble fiber as staple component of diet. High soluble fiber helps in having a favorable effect on blood cholesterol levels. Eating low glycemic index foods result in lower glucose levels after meals. Low glycemic index foods have values of 55 or less and include fruits, vegetables, grainy breads, pasta, legumes. High glycemic index foods have values of 70 or greater and include baked potato, white bread or white rice. Glycemic index is lowered by the presence of fats and proteins when consumed as a mixed meal. Thank you for watching and subscribe for more videos on weight loss and diabetes. See you in the next video.